AM 1480 WLEA.
In segment one of today's show, we're going to hear audio highlights from the St. James Town Hall meeting, which was held Thursday night, December 4th, at the Main Place on Main Street in Hornell. In segment two, Hornell Mayor Shawn Hogan talking about how that meeting went.
It's time for Top Story on AM 1480 WLEA Hornell.
We're going to start out this segment here, the segment with the audio highlights from the St. James Town Hall meeting with what Dr. Spencer Annabelle said about how the hospital loses money.
When you have a hospital system and you have an average census of 10 patients maybe right now, but in the summer it got down I think to about 7, you have a fixed overhead. You've got to pay the hospitals competitive wage or they're not going to keep coming. And the cost structure, it incredibly loses money. 63%, as Jen said, our Medicaid patients pay 86 cents on the dollar. So no matter how many of them you had, the more you have, the more you lose. The Medicare pays 89 cents on the dollar. So again, you're losing money on each one of those.
Here's what Dr. Ismail Mayer said on that topic.
Talking about what Spence said, and I agree with Dr. Annabelle about, we're losing money. The question is, what about a smaller facility with the beds that Sean's saying, 15 beds? Okay, right now we need $6 million a year. I can't imagine a smaller facility. Right now we have 500 plus employees. We have huge heating, cooling deficits. I mean, the money we lose on heating that hospital every winter is enormous. The money to air conditioning is enormous. The money for all the different offices and executives and different staff and whatnot. I mean, of course, some people will lose their jobs, but it won't be 500 plus people in a smaller, compact facility. And I can't imagine that the deficit would be $6 million a year in a small hospital that can really serve the needs. That's one question. The other one is, a lot of this is assumptions that Old Berkshire gets the funding. They find the doctors, they find the dentist. What's the plan if they don't?
Right.
What's the backup plan?
Right.
Hospital CEO Jen Sullivan's response.
Thanks, Izzy. I think that's something, again, that we can do to help ensure they do get the providers and the support of the community. Because really, the whole hard, cold reality, is that without this proposal going forward, we would be left with nothing. We are out of cash. We found a financially viable and sustainable solution, and so we need to, as a community, make this work. And so we need to do everything we can to make it work, or else we will be left with nothing. And it is a scary thought, but it's the truth.
And Jen Sullivan was not optimistic about what Dr. Mayer said about the possibility of having less layoffs if the hospital was in a smaller facility in North Hornell that was easier to heat and easier on the electricity bills. So in this soundbite, what Jen Sullivan is saying is, if St. James can get the money they need from one of the state agencies, it's going to be because they're going to a new facility and not trying to fix the current St. James building.
If we need a new facility to make this work, which we do, to achieve the efficiencies, there is district money, the $8 billion that's coming into the state to transform the system. That money is not for status quo, and so our entire building, the whole risk right here would be that we won't get any money to build the building if we try to maintain the status quo.
One big issue that kept coming up, and this is something that both Mayor Hogan and Deputy Mayor John Buckley have been bringing up a lot, is the problem of what happens if the maternity ward goes away. Dr. Uzma Mayer spoke about that issue.
Steuben County Hornell Hospital, St. James, has about 300 plus deliveries a year. Dansville has 300 plus deliveries a year. Jones has 300 plus deliveries a year. We have as many as Dansville and Wellsville. Now, if most of the people are going to go to Dansville, they're not big enough to take on this 300 influx of pregnant women and sick babies. You never know when that baby's going to be delivered, if they're going to be well or sick until they're delivered. So are they prepared to handle that? And have you guys thought about that? And if so, you do need to understand that keeping maternity services here are just as important to the community as it is to the babies being delivered. They deserve to have that care, that chance, those minutes of survival that people in Dansville get and people in Wellsville get.
Dr. Ismail.
I got called in at 6 in the morning because there was a baby in a crisis. There was a baby who was dying. That's the question is, who's going to take care of those babies when there's a problem? I mean, I know the ambulance guys are great, but when you got a newborn, you need someone who really knows what they're doing. Those are the things that I fear are going to take place when we don't have maternity centers this year. With that said, we worked on that baby for 3 hours, and I've talked to Shawn about this. I mean, there's gonna be some tragedies trying to get pregnant women to Dansville.
Congressman Tom Reed also weighed in on that topic.
When you're having parents that are going to be delivering their babies in this community, we need to address that component of this application.
Now, Jen Sullivan, the hospital CEO, spoke of one of the big financial problems she says the hospital's having.
66% of our inpatient care is publicly funded or uninsured. And so we knew we needed to do something, or else we would just simply go out of business, run out of cash, and be done.
Now, hospital CEO Jen Sullivan, she's stated before publicly that what's happening in Hornell is not exclusive to Hornell, but is happening to other hospitals in the region, and they're facing serious financial problems too. Dr. Stoner-Horry made a point of contradicting Jen Sullivan on that.
And we are being told that the same thing is happening in Wellsville, in Bath, and Dansville. It's not. It's not happening there.
Mayor Shawn Hogan went even a little bit farther. Hogan stated at the meeting, and this is not the first time he said it was a contrived crisis.
This is a contrived crisis.
One local businessman at the meeting asked if it would be possible to get a new heating system for the hospital, something less expensive than moving to a whole new building. Jen Sullivan did eventually address that statement. Here's what she said.
There is district money, the $8 billion that's coming into the state to transform the system. That money is not for status quo, and so our entire building, the whole risk right here would be that we won't get any money to build the building if we try to maintain the status quo. We need to transform the way the state is reforming healthcare so that the numbers in the future do work. And so it's not a matter of saying, well, just add a little bit more to the building, add a little bit more of a loss, and find someone to pay for those differences. It basically puts the whole project at risk. And so just to understand that, it's not something that I'm sitting here saying I don't want inpatient. That's certainly not the case. But the numbers simply don't work, and right now there's no one that can fund the deficit.
At one point, Kathy Paranello from UR Medicine spoke about the future of St. James and its partnership with UR Medicine.
We've gotten good signals that this plan that's being proposed is very consistent with the way New York State wants to see communities reorganize themselves to meet healthcare needs of its communities and its members. So we've gotten very good signals. We need, I think the Department of Health and on the state is going to want to hear from many of you in terms of the importance of this plan to you.
Now, a part of Hornell's future healthcare is a company called Oak Orchard. They're out of Brockport. And a Jim Cummings from Oak Orchard was at the Thursday night meeting. He spoke of how Oak Orchard will work with the poor.
One of the reasons that we're able to do what we do, and that's provide care for Medicaid population and for the uninsured and the underinsured, is because we do receive funding from HRSA, which is out of the Department of Health and Human Services, Health Resources and Services Administration. And they provide Oak Orchard and other organizations like ours, federally qualified health centers, with funding to make sure that care is provided across all socioeconomic groups. And so we have the advantage of that federal money every year that helps to support our practices.
Now, if Oak Orchard is able to set up some medical offices in the Hornell area, apparently it's going to depend on some grant money, which Jim Cummings said Oak Orchard's applied for.
We did apply for a new grant funding to expand that funding I talked about earlier to the Hornell site. We applied in October for what they call a new access point, and we will hear about that grant hopefully in May.
So we're hearing a lot of names here in segment 1, Oak Orchard, UR Medicine. Probably a lot of you are wondering, okay, which office do I go to if I have this, that, or the other thing wrong with me medically? Jen Sullivan addressed that.
So where can I go if I have a sore throat? You can go to your primary care physician, the urgent care center, or Oak Orchard. If you have chest pains, you would go to the closest emergency department. If you're near Hornell, you'd go to the Hornell Emergency Department. If you're somewhere else, you'd go to whichever one is closest to you. Dialysis needs, you'll go to the dialysis center that we anticipate will stay in Hornell, just under different ownership. OBGYN needs, you'd go to your OBGYN physician. Labor pains, you go to your obstetrician, the closest emergency department, or Noyes or Jones if delivery seems imminent. Where can I go if I have a stroke? Again, you would go to the closest emergency department. If the closest one to you is Hornell, you'd go to Hornell. If you have a toothache, you'd go to your current dentist, urgent care, or Oak Orchard. Unexplained pain, your primary care physician, urgent care, Oak Orchard, or again, the closest emergency department.
One thing that should be pointed out, it looks like they're actually farther ahead in their plans to move to North Hornell than many realized. When one area resident asked about the location in North Hornell and suggested that they get moving on making applications with the state and getting permission from this, that, and the other organization and agency, Jen Sullivan pretty much said that was already in the works.
If you're even considering building something, how much you're going to have to bring that field up.
I agree with you, and we've started that.
Now, one person who we played a lot of sound bites of from the town hall meeting on Friday morning's news, the meeting was Thursday night. One person who we aired a lot of sound bites of was Hornell Mayor Shawn Hogan. We didn't play a lot of those here in segment 1. He did say a lot of important things. We're going to ask him about that coming up in segment 2. But before we do segment 2, let's hear one thing that the mayor had to say at Thursday night's town hall meeting about St. James.
And to see how it has been abandoned. When we're experiencing losses of up to $6 million a year. And the state just gave us $6.4 million. Maybe more, I don't know, I'm not involved in the number crunching. But the state gave us $6.4 million to see us through this planning stage. That money ends in March. The reason for this timeliness of this, and because the short timeline, is because the parent organization has indicated they don't want to incur any more losses after March of this year, of 2015. So that's the issue. I mean, I thank Jim, and I thank Kathy, and I thank Jen, and the other organizations involved in this process, because we will have continuum care here. But is it what we deserve? No. And we should demand better.
That was Mayor Shawn Hogan. His whole take on that meeting from Thursday night, the St. James Town Hall meeting. We'll get that next in segment 2 from Mayor Hogan. Also, wanted to point out one thing before we take a break. There was a lot of people who spoke, didn't have time to play everybody. One person who said a lot of great things was Dr. Collins. Unfortunately, he wasn't microphoned terribly well, so sorry about that. We didn't get Dr. Collins in. A lot of people made a lot of great points, and for one reason or another, a lot of times, sometimes the sound quality. Plus, you have the meeting that lasted 90 minutes. This is a half-hour show, so we've got time constraints. And you have the fact that we played a lot of those sound bites yesterday on the morning news. Anyways, Mayor Shawn Hogan coming up with some very important things to say about the hospital situation in segment 2 of Top Story. Stay with us here on AM 1480 WLEA. Here on Top Story. The top story, of course, this week was the town hall, the St. James Town Hall, which was held at the main place on Main Street in Hornell. That was held on Thursday night, the 4th. And we have on the line with us now one of the participants of the meeting, Hornell Mayor Shawn Hogan. Shawn, thanks for joining us.
Good morning, Brian, and it's nice to be with you.
Shawn, pretty much everybody's takeaway from that meeting was that probably the most important speech came from you especially the part where you said that this is a contrived crisis. Can you tell us more about why you think that?
Well, I've been involved in the process, and I'm a 20-year member of the board. And in essence, when Catholic Health East, the former parent organization, came to me as chairman of the Strategic Planning Committee in 2006 or 2007, said they wanted to sell the hospital, and that they would find an appropriate partner to either purchase the assets or whatever. Well, they didn't find any partners. They did get into a cooperative agreement with Guthrie, but that went on for 4 years. Basically, once they decided they were going to shop this hospital, this institution, they sent a message they didn't want it. They didn't want to be bothered with this rural city, this rural hospital. So it's a contrived crisis only because now CHE is merged with Trinity Health, and Trinity Health definitely doesn't want to run this hospital. And so rather than try to manage it and right the ship, they're just going to walk away. And I don't believe that's right. I don't think it's part of their mission statement, which is to have a profound impact on the vulnerable and the poor.
Wasn't that the original purpose of setting up the hospital a century ago?
Absolutely. Father Early, James Early, who founded the hospital, would be rolling over in his grave. There's no reason, that we can't at least sustain some inpatient beds. They're sounding this drumbeat. They're sounding this drumbeat that it's not sustainable. I'm not buying it, and the community shouldn't buy it.
Why do you think that's not true, Shawn?
Well, because certainly the St. James, how can Noyes and Jones survive in this environment? They're saying our payer mix is so much more heavily in Medicare and Medicaid patients. Allegheny County is one of the poorest county in the state of New York. So there's something wrong in the premise and with the statistics or the number crunching that's going on. I firmly believe that. But you can't tell me this community can't support 10 inpatient beds and maternity services. There's as many babies born in Hornell as there is in Noyes and Jones. So let's cut to the quick. The parent organization of St. James Mercy Hospital doesn't want to run it. That's why I'm saying the focus should be on sending letters. In fact, they didn't even have a representative at the town hall meeting.
You're talking Trinity Health.
I'm talking Trinity Health, which was formerly CHE Trinity. Now it's Trinity. They didn't even have a representative. They want to wash their hands. They say, well, we're paying the debt. We're going to assume all the legacy costs. You ought to. You own the assets. You own the assets, you own the debt. Why would anyone take their debt? So these are the things that people have to understand. They have a mission, and their mission is to close the hospital or get out from under it. So if there is someone that's driving this engine or driving this train, it is the CHE Trinity. CHE now Trinity. They want to be shed of it. They don't want to take responsibility of a negative bottom line for this hospital, which they helped create by not responding to concerns and complaints of the medical staff and staff in the hospital to address some of the issues at the hospital. So, I'm trying to be a positive member of the debate, and I don't want to get angry about the process, but we have to speak with louder voices, because if this plan that was presented comes to fruition, there are going to be losers, and the losers are going to be the residents of the city of Hornell and the region that surrounds the city of Hornell. The quality of health care is not going to be the same as the people enjoy in Wellsville and in Dansville.
Dr. Stoner Horry brought that point up during the meeting. He said he's worked at other hospitals, and Hornell's hospital officials are claiming that this is happening to all the other hospitals in the region. And Dr. Stoner-Horry said not the case.
Right. I don't doubt that's the case. All hospitals are struggling, particularly in rural America. But they can't all go out of business. But does it make sense that a city of 9,000 people gives up its inpatient and maternity services to a hospital in Dansville and a hospital in Wellsville that are 30 and 18 miles away respectively, with half the population of this community? It just doesn't make sense. It's not the fault of noise, and it's not the fault of Jones. This situation, you're being told if this plan doesn't happen, or if we're looking for, we're not looking for status quo. Certainly, right now they have 119 licensed beds. We don't need 119 licensed. We're looking for 10 inpatient beds and maternity services, and that would serve the needs of this community. Have an average daily census of 10, you've got it. And so, people have to, write letters, send emails, whatever they can to Trinity Health. Dr. Richard Gilfellen, President and CEO of Trinity Health, Livonia, Michigan, and the address is 20555 Victor Parkway, Livonia, Michigan, 48152. And the phone number 734-343-1000. So I encourage everybody, anyone that can pick up a pen or a pencil or a phone, is to call or write and express your concerns and say, listen, follow your own mission statement. Follow your mission statement about, serving the vulnerable population and the poor, because does that mean everywhere else except Hornell, New York? That's the question, and that's the question that has to be answered. So, the health department isn't the enemy in this situation. Governor Cuomo has nothing to do with this. That's all because the parent organization decided to chop the drag anchor and move on. And a responsible corporation does not do that.
Mayor Shawn Hogan, final question. Are there any aces up your sleeve that you feel comfortable in discussing and saving in plans to save the hospital?
I've got many up my sleeve, whether any of them work or not. So just know that I'm going to continue to fight the fight for the citizens of this region, because we shouldn't receive any less health care than people, like I say, in Allegheny or Livingston counties. And that's what's going to happen. No one's even addressed transportation concerns or EMS concerns, and they both directly involve the city, and we've never even talked about them. So this plan's far from acceptable at this point, and we have to continue to fight the fight.
Mayor Shawn Hogan, thanks for joining us on this very urgent topic.
Thank you. Bye-bye.
So Mayor Shawn Hogan there with a lot to say here on Top Story, talking about the hospital and his attempts to save it. A lot of people hoping that Mayor Shawn Hogan could pull this one off and save the hospital in some form or another. I'm Brian O'Neill. Thanks for listening. InfoTrack is next here on AM 1480 WLEA Hornell.